Hey everybody, I'm John Hammarley with the Plastic Surgery Channel. I am joined today by Dr. Charlie Messa and Dr. Christine Hamori. Okay, so the first question has to do with the aerosolized nature of this virus. Are there, because of its nature, surgeries, nasal surgery or other types of surgery that you guys don't feel comfortable with? Christine, I'll start with you.
I don't do rhinoplasty anymore, so that works well for me. I do think that as you're going to have more exposure to the mucosa and nasal secretions, maybe even intraorally, you'll probably have a higher risk. But basically, we do universal precautions. So if I were doing nasal surgery, I would wear an N95 mask. I would wear a visor. We have some units in the operating room, which are HEPA filters and UV light help remove any of the toxins or the virus from the air. So basically, I think keeping yourself safe and to the standard that you'd be fine. You might have to irrigate the nasal cavity with some, antibacterial, something like a betadine or something like that to help reduce the viral load. But I don't do those type of surgeries, and maybe I defer to Charlie.
Charlie, how about you?
So yeah, just like Christine said, we do all strict protocols. Every one of my surgery patients is tested for COVID within 72 hours of their operative procedure. So, and once the test is done, they are requested that they stay home or stay quarantined, so to speak, before the actual operation. The biggest risk for surgery is during the intubation and the extubation, but during most facelifts and rhinoplasty procedures, the airway is through a closed circuit through an endotracheal tube. But like Christine said, we use betadine to prep the face, the nasal passageways as needed. So that's going to eliminate a lot of if they potentially had the virus, eliminate it. And then also my anesthesiologist, as well as all my operating room staff, wear N95 masks, eye protection. And during the intubation, extubation process or procedures, we are separated away from the anesthesiologist so that there's minimal, if any, potential exposure, which makes it safe. And again, it's all about doing all the right things to keep yourself safe and limiting your risk.
Are there procedures now? You probably have already answered the question, but Christine, I'll ask you, are there any procedures right now that you would say to a potential patient, let's wait a little while. Let's wait until the vaccine is here and everybody's more protected?
I may consider that in an older patient or an obese patient that maybe is undergoing a very long type procedure, maybe an abdominoplasty with liposuction, who's kind of teetering with a very high BMI, maybe has diabetes or some other comorbidities. A relatively long surgery, I might think about that, because I think just to start with, they have a higher risk for COVID in general. And there's been no case to date of an asymptomatic person undergoing plastic surgery and developing a problem. They've gotten COVID, but they've never had a medical issue requiring hospitalization. So I would just want to be careful with that elderly patient that would be obese for a long procedure. I might say, let's wait another year.
Mm-hmm. Charlie?
I agree with what Christine said. It's like with any elective cosmetic surgery, you have to consider the patient's comorbidities. So if you're talking about a patient with a BMI that's over 30, 35, who has diabetes, maybe a history of pulmonary disease like asthma or other disease process that makes them at higher risk if they would happen to contract the virus for more severe illness, I think those patients maybe should reconsider until there are more therapeutics available, readily available, like Regeneron and remdesivir, as well as a vaccine. So I think a good, sound surgical judgment, like with any elective cosmetic procedure, don't operate on the patients that are highest risk for a potential postoperative complication. And I think you're going to be very safe going forward. I wear a mask all day long in the operating room. I keep social distancing with any patients and any interactions I have outside the office. So, and we are checked for temperature every day here in the office. And no one comes into the office, either pre-op, post-op, or a follow-up patient who has any symptoms at all, no matter how minor. So we're being very strict about who comes in and out of the office and how we treat my staff and fellow patients.
I think that the risk comes from people that are not being as careful. And I believe keeping your pod small, wearing masks everywhere, wearing masks in the office, and having screening. I think those are the best chances. But I don't routinely test for surgery.
Thank you so much, you guys.
Thank
This
you.
is an example of how the Plastic Surgery Channel can bring you the latest information on all the questions that you might have about plastic surgery, especially in these sensitive times that probably are going to go on for at least months to come. And if you want any more information, please come to theplasticsurgerychannel.com.